They're coming in.
Well, hello, everyone. Welcome. My name is Arthur Stimoulis. I'm going to be hosting today's briefing. We're working on getting the live stream up and running, and they're going to begin in just a moment. Thanks so much for being here. And Ryan, I'm seeing something on my screen. Are we good to go, or do you need another minute or two?
Not yet. I will let you know.
All right. Thank you. So if you're here for the briefing on Omicron and the End the Pandemic Now plan, you are in the right place. Thank you again for joining us. I'm seeing people streaming in now. We appreciate you being here. We're going to get started in just a moment as we get the live stream up and running, but thank you. And again, as more people come in, I'm going to repeat myself. My name is Arthur Stimoulis. I'm moderating tonight's discussion. We're getting that live stream up and running. We're going to get started in just a moment or two, but thank you for being here. You're in the right place.
We are good to go, Arthur. We're up.
And excellent. Thanks so much, Ryan. And thank you, everyone, for being here. Good evening. Welcome again to tonight's emergency briefing on Omicron and the Pandemic Now plan. My name is Arthur Stimoulis. I'm the Executive Director of Citizens Trade Campaign, which is a national coalition of labor, environmental, family farm, faith, and consumer organizations that works together to improve U.S. trade policy. And this year, we've been working very hard to try to get existing trade rules out of the way of increased COVID vaccine and treatment production. And so I'm going to be moderating tonight's briefing. And in a moment, I'm going to turn things over to our four wonderful presenters, Lori Wallach of Public Citizens Global Trade Watch, our Congressional Champions, Congresswoman Jan Schakowsky and Congresswoman Rosa DeLauro, Mahir Moncad of Doctors Without Borders. And before I give them the floor, let me just provide a little context about why we're here today. So since the start of the pandemic, public health experts have repeatedly warned us that Americans will remain vulnerable to new COVID variants that prolong the pandemic here and that prolong the pandemic everywhere until such time as vaccines, test kits, and treatments are readily available throughout the world. In other words, vaccinating our own population, as important as that is not enough. If we want to prevent the coronavirus from mutating and requiring round after round of boosters and potentially even new vaccine formulas altogether, we need to help vaccinate the globe. That's the reality of the situation. And if the repeated warnings of scientists weren't enough to convince us that this is the reality, the Delta variant should have been. Delta developed overseas in a country that had over and over again asked for permission to make more vaccine doses. It was denied the ability to do so by the pharmaceutical monopolies. And as a result, Delta quickly spread throughout the entire world, causing untold levels of human suffering. And so we had the scientists' initial warning that vaccinating ourselves isn't enough. Then we had the Delta variant to prove that that warning was accurate. And now we face the Omicron variant that's proving it once again. And so we know the world needs the same access to vaccines and treatments that so many Americans take for granted. We need that to save lives abroad. We need that to save lives and end the pandemic here at home. And yet 2 years into this pandemic, less than 8% of the populations of low-income countries have had access to even a single COVID shot. And there seems to be this unspoken belief that, well, eventually Americans and Europeans and other affluent nation citizens won't need shots anymore, and leftover doses will trickle down to developing countries. And I think the Omicron variant should be showing us the folly of that thinking, because there's now an increased demand for boosters, there's an ongoing demand for shots for our children, and there's even more talk about potentially needing a new vaccine formula to more effectively defend against variants. And so as we get our third shots and potentially even a fourth shot, billions of people around the world are still waiting for their first shot. They're still at the end of the line, and that line is not going to go away until production is increased. And that's where an exciting new measure in Congress that we're going to be talking about today comes in. Representative Schakowsky and Representative DeLauro's brilliant End the Pandemic Now plan, H-Con-Res 60, or House Concurrent Resolution 60, lays out in one place all the major steps that our government needs to take to increase global production of COVID vaccines, test kits, and medicines to save millions of lives at home and abroad, and to help bring this pandemic to a close. So to introduce the Congresswomen, let me now bring on one of the co-founders of Citizens Trade Campaign, a decades-long leader in fair trade struggles as the director of Global Trade Watch, and the soon-to-be head of the Rethink Trade program at the American Economic Liberties Project, Lori Wallach. Lori, thanks for being with us. The floor is yours.
Thank you very much, Arthur, and hello to fair trade activists across the country. Thank you for joining us this evening. We are super excited to have two of the most amazing congressional champions for working people, for health, for women, for the environment. Two members of Congress, if only the whole Congress was like Congresswoman Jan Schakowsky and Congresswoman Rosa DeLauro, we would have a much better country and our policies would be so wonderful. We would all be dancing in the streets. So we're super fortunate to have them caring so much about this issue. It's because they're smart and they realize all the things they care about: working people and our livelihoods and our jobs, families feeling safe and secure, medicine being affordable so everyone can get access, development around the world, human rights, all the things that we care about. They're trying to figure out how the hell to get the pharmaceutical companies out of the damn way to be able to get enough COVID-19 vaccines, treatments, and tests to end the pandemic. Because that's the only way we're going to be able to get to the business of all the other stuff we care about. Pandemic is undermining it all. So the End the Pandemic Now resolution, which the technical number for it is House Concurrent Resolution 60. So in Congress-ese, that's H-Con-Res. You'll see it as H.Con.Res. H-Con-Res 60 is the roadmap that lays out basically the different steps that are needed, which boil down to getting the intellectual property monopolies that the World Trade Organization requires every country to guarantee to big pharma, that lets them limit how much vaccine, how much treatment, how much tests are made. That needs to be waived, number one. Number two, the government needs to use its existing authority to compel the existing vaccine monopolists who took a boatload of our taxpayer money to make those vaccines to share the recipe. So first we get the barriers of IP out of the way. So we open the gate, and then the technology transfer speeds up the actual production, because there are, as we just heard from Human Rights Watch, 100 developing country producers who can make the top end mRNA vaccines right now. It's baloney that it can't be done. There are 100 that they have identified. So we need to unlock the IP, speed up the process by getting the technology transferred, and then the money. Already $16 billion was allocated by Congress. Congresswoman DeLauro is the chairwoman of the Appropriations Committee, an incredibly mighty position. And that money has not gone out the door to actually creating the distributed production that needs to be around the world. We just don't have enough. So without further ado, we're going to hear about the situation, the problem, the answer, the resolution. So Congresswoman Jan Schakowsky she represents the Illinois 9th Congressional District, a little north of Chicago. She's got all kinds of really important titles. She's a subcommittee chair on the Energy and Commerce Committee on Consumer and Health Issues. She's the senior chief deputy whip. She's on the Steering and Policy Committee. She is just a kick-ass leader for health and for working people. Congresswoman Rosa DeLauro represents the 3rd District of Connecticut, New Haven, and has, as I mentioned, the chairwomanship of the Full Appropriations Committee. She has been a fair trade champion and leader, and is the person, along with Congresswoman Schakowsky and Congresswoman DeLauro's band of other colleagues, who saved us all from the TPP. These two women are part of the team that saved us all from the TPP and helped make NAFTA get renegotiated decently. So we're super honored to have them both here. And I would please introduce Congresswoman Schakowsky to start us out, and then Congresswoman DeLauro. Thank you so much for joining.
Thank you.
Congresswoman Schakowsky, your mute is on.
Okay, it's been such a pleasure and an honor to work with this incredible coalition that has been put together around the world. The most articulate and clear-headed leaders who have been fighting. And it's just such an outrage. I mean, every time I think about the fact that this has been going on for at least 1 year, when there was the effort to get, with all 100 some countries to get a waiver of the TRIPS agreement so that manufacturing could go on around the world. That's the only answer, or at least one of the only answers. But the other thing is that is outrageous to me, that the US taxpayers have put so much money into, particularly into Moderna, but also helped Pfizer, and the behavior of the pharmaceutical industry. Big pharma actually has the power. They could do it on their own, even without a TRIPS waiver. They could say, yes, we understand that every human being on earth is in danger, all of us, and it could come back to bite us in the United States of America, that we are going to end this pandemic by sharing the recipe, the know-how, and making sure, and yes, a pause in the intellectual property rights that seem to be the only thing they care about profits over people. So yes, we have introduced a resolution into the Congress. We have a number of co-sponsors on that. Rosa and I are in the lead. I do want to tell you some of the co-sponsors, because we are going to need your help to add to that list. We have Earl Blumenauer, Lloyd Doggett, Adriana Espaillat, Pramila Jayapal, Ro Khanna, Andy Levin, Raja Krishnamurthy, Barbara Lee, and there are others too, but those are some of the leadership people. So we're going to need your help to get more sign-ons. But in some ways, when Omicron has proven the case. We have been warned over and over again that there's going to be a variant. We may get lucky. This may not be the one that kills us all, but it could be part of, what this wily virus does. So we are definitely not, any safer. I think we are absolutely less safe. The models that we can't have is leftovers that we can, give when we have too many. And we do not want a charity model either. I mean, COVID's fine, that's good, but it doesn't meet the need that we have. We cannot have a charity model. We have to have one that allows countries and in hubs and places where the know-how is the capacity, put it that way, is there. And I think Big Pharma is also racist in saying that, these people aren't smart enough, they don't know enough, they can't possibly do it. They can absolutely do it. So the US government itself can play this role with the WTO, which is on the verge really of collapse if they don't act on this. It's a fragile institution, and if their failure to deal with this crisis comes about, then there's no use for the WTO. They have to recognize that our trade representative is working with the Europeans and others to try and move this along. But in addition, the US government must leverage its massive taxpayer investment to make sure that we can use the Defense Production Act. In other words, we have tools right here that actually could be done. So I'm gonna end with that. There's I know a number of speakers, and there's a briefing that we all need. But I just want to say that I couldn't do any of this without Rosa DeLauro and the powerful person and the powerful leader that she is. So let me end there. We can do this. We can do this. It's within our power.
Indeed, it is within our power and we can do it. And Congresswoman Schakowsky and I are joined at the hip in this effort, and she's been such a leader on this issue. And I would just want to say good evening to all of you, fair trade activists from all over the country. Thank you for your commitment, your dedication, and your values. It's about what motivates and drives you to be engaged in this effort. And thank you for working to end the pandemic now, which is what we are about. At this moment, the stakes could not be higher. Failure to enact a meaningful waiver to scale up COVID vaccine, treatment, test production will prolong the pandemic. It's going to cause more death and economic hardship and social and political disruption. Now, these are, there is a moral imperative here that we need to be engaged in making sure that we can end this vaccine. And it is not, the United States has been the leader and is the leader on getting donations to other countries, but that is not enough. But what they need to do is to use their strength to get the other countries who have committed to doing something, the other industrialized countries, the European countries who have said they would help, but they've got to push them to do that. It's about ensuring that people worldwide can get vaccinated, access those tests and treatments. It is the only way we end the pandemic. And so proud to be a co-author of the End the Pandemic Now resolution with Congresswoman Schakowsky and 16 others. She's mentioned some of the names of the folks who are on this. And what we want to do, one of the goals tonight is that we need your help to bring more members on board in this effort. You know that you need to pile up the co-sponsorships of these efforts in order for them to pass in the House of Representatives. And this is a critical resolution, and it calls on the Biden administration to continue their efforts to work with nations at the WTO to pass a waiver of the TRIPS agreement, to speed up the technology transfer, the production, the manufacturing of COVID-19 vaccines around the world. We can't have people say that they have a monopoly. They can't share the recipe for the vaccine. This is about saving lives. We're not talking about constructing a road, a bridge, or anything else. This is about saving people's lives. And as my colleague Jan Schakowsky has pointed out, and I will give you the example of Moderna. The United States provided $10 billion to Moderna in order to have them work to invent a vaccine. They had never brought a product to market before this. And it's really outrageous that they will not even now recognize two of the scientists at the National Institutes of Health who co-invented the vaccine. They want it for themselves. It's nothing but greed. And we need to, and what we need to do is that the administration, and we need to push the administration to really, if you will, beat them up in order to get them to move on this issue. In addition, the effort, the resolution says let's leverage existing legal authorities under the Defense Production Act to compel COVID-19 vaccine makers to share the recipe with willing and qualified companies around the world. And yes, there are qualified companies around the world that can do this. And it is just not the recipe, but it is the technology and it is the help with the infrastructure in order to be able to get people vaccinated. The Biden administration's leadership is necessary to relying on the United States to deliver. The strength of the United States has got to be felt. Achieving a waiver at the WTO would help to restore the US's standing around the world, create a sense of relief among US residents that their president is taking strong action to return normalcy to their lives. Instead of lamenting about what China or Russia are doing, let's take control, let's take charge, let's be the leaders on this effort. We are going to continue to fight relentlessly for a waiver of the WTO's intellectual property barriers until people worldwide can get the medicines they need to be safe and the COVID-19 pandemic is ended. We can only say thank you to you. You are the foot soldiers. You make a difference. And you know, my colleague Jan Schakowsky, who was a community organizer before she got to the Congress, I have that background as well. And we know, and you know, that the Congress responds to external pressure. You are that external pressure. We need your help now more than ever to do what? To save people's lives around the world. Thank you. Thank you so much for what you do.
We are so fortunate, friends, to have these two congressional champions. If you had any question about whether we can do this, your doubt should be dispelled entirely after hearing from our champions. And just again, to put this in perspective, Congresswoman DeLauro is the person who looked the TPP in the eye and said, what do you mean it's not stoppable? I'm stopping it or it's going to ruin the damn country. And then she did. And one of her partners in crime was Congresswoman Schakowsky. And Congresswoman Schakowsky said, what do you mean the US never, what? Is going to go for big pharma over like lives at the WTO? Forget about it. And she got 105 of her colleagues on a letter with the help of Congresswoman DeLauro and others. That is part of the reason that amazingly, wonderfully, yay, Joe Biden announced he was for the TRIPS waiver. It's a huge historic thing. And it wouldn't have happened but for the leadership and the support. And as Congresswoman DeLauro said, the warning from the bottom up of a lot of people bugging the stuffing out of their members of Congress until 105 of them got on that damn letter. And then that letter was basically sort of a smoldering flare coming from Congress that they better get their act together and do this. So that's where we are now on this resolution, because the great news is the administration did say the right thing, and everyone should feel really great that you helped make that happen. That is no small thing. Historically, you guys know I've been doing this for a long time. That was a really important thing, but just got to face up to it. It's been over 8 months and the damn thing hasn't been delivered. And as both of our champions have said, it's only going to happen if the US really steps up. And in part because at this point, the obstacle is in part Europe. And it's not like the obstacle is China. And we can't do anything about it. Its closest ally is the problem. So there is what the US can do with more leadership. And so part of our mission here, and the reason we have to get a lot of co-sponsors on this quickly, is to basically demonstrate to the president, both, we've got his back. Here are all these people in Congress who are there with you, but also a little bit that we're chewing on his ankles, that he better get going. It's a combination of both. And that is what the co-sponsorship drive is. And that's why the roadmap of this is so great. So we're going to hear next from Mihir, but before we go there, I just want to reiterate to folks that, there are a lot of distractions. There are a lot of other things going on. And as we all know, as organizers, you only get noticed, you only get your thing done when you make it impossible not to. So part of what we need to be doing from the bottom up, and now with members of Congress going home, we're going to need to be actually organizing with our friends and family in different organizations, through the faith communities, through the labor unions. We've had amazing leadership from the flight attendants, the nurses, the teachers. So there's a lot of great work. Arthur's going to explain a little bit how to get together with people in your community, but basically just getting with your member of Congress. Frankly, just go into the blue pages in the phone book, and you're going to look up your local offices, because members are home, and ask just directly, I want you to get on this resolution, HConRes 60, stop the pandemic now. Asking, you can't imagine how much effect it is when you just have a bunch of calls going in directly. And it's not a machine calling, it's not an email. At a certain point, the local staff calls up the chief of staff and says, is our boss on this thing? Because there are a lot of calls about it. That's our mission. So there are a bunch of lies to debunk. I think we're going to hear from Mihir about a bunch of those. And then in the Q&A, we can go through them. But the bottom line everyone needs to understand, because you've probably seen a lot of stuff about this, there is still a shortage. The reason that only 8% of people, less than 8%, 7.4% of people in developing countries have gotten the first shot. Consider this, 6 large Southern African countries have had less first shot vaccinations than US folks have had boosters. Yeah, we need the boosters. It shouldn't be an either or. We just need more vaccines. That is the answer. It is not someone should suffer and someone else. No, we just need more. And that's what this resolution and this mission is about. So there's a lot of baloney. The bottom line is still pharma's controlling it. They're spewing a bunch of lies. There aren't enough shots. There aren't enough treatments. You've been reading about these new treatments, hearing about these new treatments. That's going to be the next shit show. So we've got to be on top of making sure enough of this stuff is made. We can do this. We can stop this pandemic, and we're going to have to. Thank you.
Thanks so much, Lori. And thank you, Congresswoman Schakowsky, Congresswoman DeLauro. This End the Pandemic Now plan and roadmap is so important. Before we dig deeper into the action steps that Lori mentioned and open the floor to questions, I want to turn things next over to Mahir Wankad, a human rights lawyer at Doctors Without Borders, who spent the past 15 years challenging injustices in the global economy with a special focus on access to medicines. Prior to joining Doctors Without Borders, Mahir worked with the Center for Economic and Social Rights, and he's also worked with the United Nations former Special Rapporteur on the right to health, involved with fact-finding missions in numerous countries, including Syria, Vietnam, Ghana, Guatemala. Mahir, we really appreciate you being here. Please take it away.
Thank you, Arthur, and thank you, Lori, and thank you, Congresswomen DeLauro and Schakowsky. It's lovely to be here. I really appreciate that the campaign has invited Doctors Without Borders to provide this briefing to all of you. I'll just say a little bit about Doctors Without Borders and then go into the weeds, as it were. So, of course, I work with Doctors Without Borders, or Médecins Sans Frontières, MSF, and we're an independent international organization that delivers medical care to people in crisis in over 70 countries. And since the start of the pandemic, our doctors, nurses, and other healthcare workers have been racing to respond to COVID, and not just COVID, but the disruptions that COVID's had on other health services as well. I mean, we've just really been scrambling all around because of it. And just this year, MSF maintained about 165 projects related to COVID in 52 countries. So, we've got a pretty big footprint on the ground when it comes to dealing with COVID. But before I go into saying a little bit more about COVID, I just wanted to say that, as many of you know, we've already been here, and we need to learn the lessons of what happened before and put them to use in this case. So in the early 2000s, MSF was on the front lines during the peak of the HIV AIDS crisis, at a time when communities around the world were really struggling to access life-saving antiretroviral treatments that they couldn't afford. Things were so bad that people with late-stage AIDS were coming to our health centers in wheelbarrows because there were no treatments for them to prevent their HIV from progressing. And at the same time, people in Europe, people living with HIV were on treatment. In Europe and the United States were on treatment and living relatively normal lives. And the reason that this happened was because of the greed of the pharmaceutical companies. It's because of them and their refusal to share their intellectual property to increase the supply of HIV AIDS medicines and make them affordable to everyone, that people were in that position, dying, coming to our centers in wheelbarrows. But it's because of the tireless work of activists like yourselves, pushing back on these companies, on their monopolies, that these medicines became widely available for a fraction of their original prices, and that saved millions of lives. So I think it's just something we should bear in mind, that we've been here before, we've been successful, and now we're making an even bigger push to get even more out and potentially to put an end to this situation once and for all. So MSF is still on the front lines and bearing witness to COVID, how COVID is affecting vulnerable communities around the world. So many nurses and doctors at MSF have said that working through the pandemic is going to be the greatest challenge of their entire medical career. And in addition to working long hours in overwhelmed health centers in places like Brazil and India, our teams have been and are still forced to treat patients without access to adequate tools, COVID-19 tools in these communities. So people have said so far, fewer than 9% of people in low-income countries have received even a single dose of the COVID-19 vaccine. And the majority don't have access to tests. So we don't even know how many people actually are getting COVID. I mean, the numbers are that are reported are way under what's actually going on. And now it looks like, and Lori just mentioned this, rich countries are going to buy up all of the supply of the critical new medicines that are coming out for COVID-19 before poor countries even have a chance to make an offer. I mean, it's shocking to me that we're in this situation, just a year ago, and now we might be in the same exact situation in 2 months when it comes to medicines as compared to vaccines. So everything we do is really profoundly affected by the pandemic, whether it's directly related to COVID-19 or not. Every healthcare worker that spends their time managing COVID-19 is limited in what else they can do. And that's in communities that already have such limited access to healthcare. So that means fewer obstetric services, fewer nutrition services, fewer trauma care options, fewer childhood vaccinations, fewer sexual and reproductive health services. It also means people can't go to work, that they might lose their jobs, they can't support their families or spend time with their loved ones. And it means that, and this is what we're seeing, that global inequality spirals even more out of control. So I want to say something that both I think Arthur and Lori alluded to, which has been making the rounds, a claim about some places turning back vaccine deliveries and that we don't need more vaccines and treatment. We definitely do. Right now, only 5 countries are projected to reach the World Health Organization's 2021 target of being fully vaccinating 40% of their populations by the end of the year. That's less than 10% of the entire continent of Africa. And there's still no plan to make enough doses to meet President Biden's stated benchmark of vaccinating 70% of the globe by next September. So what's true is that while some African countries are struggling with hesitancy, there's no evidence that the problem there is any worse than the problem is here or in Europe. And many countries on the continent have already distributed their vaccines really quickly and continue to request more supply. So for example, in Botswana, they have about a 76% acceptance rate of vaccines, but lack of supply remains a critical issue. They just need more. And we need to understand the complexities around supply and demand as it concerns vaccines in lower middle income countries. So what's happened so far has been basically an extremely poor rollout on everybody's part. Unpredictable delivery schedules have made it really, from vaccine manufacturers and from COVAX, have made it really difficult for already overburdened healthcare systems to absorb these vaccines. African countries went months without receiving any notice about doses they were going to get, and then suddenly had millions of doses dumped on them, lots of them that were soon to be expired. Imagine that happened here. We couldn't do it either. So with having this little advance notice, no one's been able to adequately plan their implementation and vaccination campaigns. And Tom Frieden said the other day that vaccine manufacturers haven't even met their global production pledges, and access to the most effective vaccines will continue to be limited. So for example, COVAX promised to provide 2 billion doses by the end of 2021, and we know that they won't even be able to provide half of that. So we most certainly need increased vaccine and treatment production in 2022. And that's especially true as we begin booster campaigns in high-income countries, because that's going to put a drain on supply. Just yesterday, the Financial Times reported that there's going to be a global shortfall of about 3 billion COVID vaccines early next year if high-income countries aggressively boost adults and begin to open up immunization for children. But this doesn't have to be an and/or situation, obviously, as everyone's mentioned. If we had more vaccines, if other places were able to make these vaccines, then we wouldn't have this problem. So why does this matter? Well, I mean, that's obvious to everybody. I mean, outside of it being a critical, maybe the most important human rights issue that we're facing right now, people's lives are at stake. But even outside of those really important facts, the longer we go without having equitable access to COVID vaccines, medicines, and tests, the longer it's going to take to end the pandemic for everybody. MSF's been saying this from the start of the campaign, since the start of COVID. No one is safe until everybody's safe. So as long as huge numbers of people remain unvaccinated, COVID has the opportunity to spread out of control, which is leading clearly to the emergence of dangerous new variants. Look at Delta, which emerged in India early on when the country hadn't yet been able to vaccinate many people. Or now look at Omicron, which emerged in South Africa in a similar situation. And these are super worrisome things, not only because case rates are going up, but because, like in the UK, they're expecting to see the highest caseloads of the entire pandemic this winter. I mean, we're talking about, however long after, like 19 months, 20 months from the beginning of the pandemic. And ultimately, these variants, and even potentially Omicron, may make our current vaccines ineffective. There's some evidence right now that even the current 2-dose regimen is going to be less effective at preventing Omicron. So while we applaud the success of the scientists and researchers who work to create these tools, it's not enough to create them only for the global north. During a global pandemic, when intellectual property rules shouldn't give companies total control over who gets to make COVID-19 vaccines, medicines, and tests. We can't forget about medicines and tests because they're going to help prevent people from dying. And these rules shouldn't get to decide when, and the companies shouldn't get to decide when people, have access to these things and which countries have access to these things. Pharmaceutical companies have already made billions of dollars. Some people are projecting that the Pfizer vaccine will be the most successful pharmaceutical product in history. And I believe that Pfizer's profits for this year are around $38 billion, or their revenue, rather, projected earnings. I mean, it's unreal levels of money. So the US government has to choose to stand on the right side of history. As we know, South Africa and India put forward this proposal to waive intellectual property rules for the duration of the pandemic for all COVID-19 tools. And as MSF, we've been urging the government to do as much as it can to push Europe and other countries that are currently obstacles at the WTO to adopt the waiver. And in this waiver, it can't just be for certain products, as I've been saying. It can't just be for vaccines, it can't just be for medicines, it can't just be for testing. It has to be for everything, because there are situations. First of all, you need to know if you get sick, you need a test. And then once you do, you have to know what kind of treatment you should have access to. And even before that, obviously, if you can get vaccinated, then you should. But we need a proposal that allows for access to all of these things, to provide kind of the full chain of, full spectrum of medical tools that would be necessary to ensure that, that people don't get sick in the first place, but if they do, that they're treated and they don't get very unwell, and God forbid they die. So that's all I'd like to say. I think, outside of just, again, supporting the End Pandemic Now resolution that's been put forward by Representative Repowsky and Representative Laura, amongst others, and I'm very glad to answer any questions any of you might have about anything specific. Thanks.
Yeah, thank you so much, Mihir. That was extremely helpful. Before we do open it to questions, I just want to take a moment to go over the most important piece of any briefing like this, and that's the action steps. We've heard repeatedly tonight why the End the Pandemic Now plan is so desperately needed, and also what a fantastic tool it is in terms of how it provides our elected officials with a clear roadmap for helping to vaccinate the world and end the pandemic. And so what we need now is to really increase the political demand for this plan to be immediately implemented. We need there to be a buzz about it in Washington, D.C. and all across the country, so that officials in every branch of government recognize this is our path forward out of the COVID crisis. And so we're asking for everyone's help in two major ways. First, by reaching out, convincing your U.S. representative to co-sponsor the End the Pandemic Now resolution. And second, by spreading the word about the plan among your social circles. So already in the chat, and tomorrow for everyone on the Zoom, you'll be receiving an email from me that includes a link to emailing your U.S. representative and asking him or her to co-sponsor the End the Pandemic Now plan, HConres 60. And so if you're someone who's been moved by what you've heard today, taking that moment to click that link and write your U.S. representative and urge them to get on the End the Pandemic Now resolution is, number one, the easiest thing you can do. It will take far, far less time than it's taking you to watch this briefing. Please do it now with the link in the chat and look for that email tomorrow. But as Lori suggested, even more than sending a template email, if you're someone who has a good relationship with your member of Congress or the staff in your Congress member's office because you represent an organization or you're politically active or you're just a constituent who cares about this issue deeply, I'm also going to include in that email a link to a one-pager about the resolution, a fact sheet busting some of the myths that Big Pharma's army of lobbyists has been spreading to try to justify their refusal to share vaccine-making permissions and vaccine-making know-how. So, as Lori said, we want you to do more than send that email. If you're able, please call your representative staff, ask them to get their boss to co-sponsor this resolution. The more calls we can get, the more members will get on this. And as been said, the more co-sponsors we have on this, the more cover it will provide for the administration to implement this plan to its fullest. So please reach out this week and encourage your representative to co-sponsor. And the last thing I'll just say on this point is, if you're going to be meeting with your member of Congress over the holiday recess, or even if you think you might bump into them at a coffee shop or the grocery store or at church or wherever, please be ready to ask them to co-sponsor the End the Pandemic Now resolution during that encounter. Other than August recess, this is the time of year when many members of Congress are spending the most time at home in district. They're not hearing from corporate lobbyists like they are on the Hill. They're interacting with constituents. They're interacting with people like you, and we need your help taking advantage of that moment. So job number one is getting your U.S. rep to co-sponsor the End the Pandemic Now resolution. And job number two is spreading the word about it among our social circles. So already in the chat and in that email you'll get tomorrow, in addition to the link and information for contacting Congress, will be a link to social media toolkit that has sample text and hashtags and images and links to make it as easy as possible for you to share information about this plan on your Facebook page and your Twitter accounts. We need to brand this plan, the End the Pandemic Now plan, get it into the popular consciousness so that everyone knows what our government needs to be doing as we head now into our third year of this pandemic. What we absolutely do not want is we do not want to be on a webinar a year from now talking about the Sigma variant or the Omega variant and how we're heading into our fourth year and there are still billions of people who haven't had their first shot. So please contact your U.S. representative in support of the End the Pandemic Now plan. Please post about it on social media this week. And to wrap up, I'll just say, as others have said, already this year, we've made remarkable progress in convincing the Biden administration to reverse decades of bad U.S. policy on pharmaceutical monopolies. There is no doubt in my mind that a large number of the vaccine donation measures and similar programs that have been announced in recent months is a result of that political demand that you've helped make to end monopolies on COVID vaccines. So the work that you've already done has been historic in terms of shifting U.S. policy. It is already saving lives, but we know we have more to do if we're going to save more lives still and finally end this pandemic. So again, check the chat, check your email boxes tomorrow. Help do all you can to promote the End the Pandemic Now plan. And so at this point, let's take some questions. If you have a question, please type it in using the Q&A function at the bottom of your screen. I can't promise we're going to get to all of them because there are a bunch already, but we'll get to the ones we're able to. And let me just start with one. So isn't Europe the biggest obstacle to enacting a TRIPS waiver? And if that's the case, why do we need to do more work here, given the president already supports it? Who wants to tackle that one first?
I'm happy to. Congressman Repowsky.
Go ahead, Congresswoman. And I think you're on mute still.
Jan, you're still on mute.
The countries that oppose this and are often the countries that have their own pharmaceutical companies, and they're working hard to protect the profits of those companies. So it gets down to greed of big pharma. But it's really unforgivable that the European Union, we thought there was a moment in time that we thought when the President of the United States supported the TRIPS waiver that the rich countries would go along. Not so. Germany initially was the one that was opposing it the most. This once again is about profits over people. And we have to break through that. This is too big, this is too important, and these countries are shamefully in the pocket of these corporations at the expense of millions and millions and millions, really all of humanity.
I would just add to what my colleague said is that there's an imperative here for the United States to be a leader in this effort. And despite the recalcitrance of other countries, and yes, there's pressure being applied there, but that pressure needs to come to the United States. The technology was discovered here. We used billions of taxpayer money to create the vaccine. And we have been the country that has provided the most donations. But at the moment, I think a part of our effort needs to be the recognition that the United States, in what has now become the most serious and the biggest humanitarian crisis in the world, that the United States is taking its role as leading that effort. And not being pushed and pulled into trying to do that and exercise its leverage and strength with those countries that are not doing what they ought to be doing. And as again, my colleague pointed out, of taking on the pharmaceutical companies who are putting the greed before trying to save lives, which is what their mission is. And that's why we gave them the money, so that they could invent a vaccine and create a vaccine that would save lives. So the United States is so much at stake for the United States in this effort in terms of its world leadership.
And also, just to add very practically on top of both of those very good points, it's not just that the US can pressure our close ally. We're not dealing with an entity that isn't going to be a partner or listen to us and be inherently hostile, but also the situation we have now and why it's really important to have more pressure on the US, the US has to lead, is because we don't have yet the specifics that can shame the EU into having to join. So right now we have the US saying, for instance, we're in favor of building a bridge. And we have Europe saying, we hate bridges, we're not doing bridges, no bridges. The problem is the US is looking at a pile of bricks and timber, and instead of saying, and I will take that particular model and I'm going to lay out the specifics and who will join me in making the bridge this way, the US keeps saying, I'm for a bridge. And this allows Europe to say, I'm against a bridge. And so what we have to do is get the US to step up and say, I'm starting to build the damn bridge. So Europe, you can either say which brick you don't like, or you can try and fight me over it, or you should go over here and help us build the bridge. And that's the thing that we need at this point. It's a technical legal matter. We need the US to engage in what are called textual negotiations, where they actually start, basically calling Europe's bluff. And if Europe wants to, in the end, like after May 5th, when the US said they were for the waiver, most of the rest of the world signed up and went, me too. So I think, and it's not just from opinion, it's from a hearing in Geneva, that the US started to get down to brass tacks, as well as the diplomatic pressure the congressmen are talking about. It's going to be really hard for Europe to continue to blow it up. So that is why the US really needs to step up and lead.
No, thank you for that. Next question, and maybe Mihir, this one might be for you. Are these new COVID pills from Pfizer and Merck being produced in more places than the vaccines have been?
So They will be, but not as many as necessary. And for the moment, especially the Pfizer pill, won't be able to be produced anywhere until next September, I believe, or sometime in the second half of next year. Both Merck and Pfizer have signed licenses with an institution called the Medicines Patent Pool, which are designed to expand production. But those licenses are really limited, and a waiver would supersede them. We need anywhere, any country, any company, in any country to be able to produce these, as long as they can do so safely, obviously, so as to ensure as much supply as possible. In most cases, the licenses cover maybe 50% of the world's population. So, you know, what about the other half of the world? And usually they exclude lots of huge middle-income countries like Brazil or India. So there could be no producers in those places. And as a consequence, those countries will have to buy their pills directly from Pfizer at exorbitant costs. So they'll obviously be able to afford less, which means less people will get treated, less lives will get saved.
Very good. So another question is, can we get a list of factories around the world that are able to produce COVID vaccines? I mean, I'll just take that one. Yes, we will include that in the email tomorrow. You know, there was an article in the New York Times not too long ago that listed sort of their top 10 facilities in Asia, in Africa, in Latin America that have the equipment, the expertise, the regulatory regimes in place to safely be making these COVID vaccines. And as Lori mentioned just yesterday, our friends at Human Rights Watch, backed by Doctors Without Borders and Public Citizen and others, published a list of 120 facilities around the world that have the capability to make mRNA vaccines. And it's not, you know, it's not a question of countries not being able to produce these. They have the expertise to do so. What they don't have is the permission to do so. And so we need this End the Pandemic Now plan to get the IP waivers, to allow more facilities around the world to be producing these as fast as possible, and to require the sharing of formulas and recipes so that, you know, they don't have to wait around reverse engineering products. They can start, you know, as soon as possible producing things. And as one of the congresswomen said, you know, it is a racist myth that only American and European companies can produce these things. Developing countries have been producing high quality vaccines for decades and decades and decades. Some of the highest quality, most high-tech plants in the world are in developing countries. They know how to do this. They don't have the permission to do so. And that's what we're trying to achieve with this End the Pandemic Now plan and with the campaign that you're all a part of. There's a comment about social media, and rather than me try to recap it, Melanie, do you want to take yourself off mute and just mention this? Melanie Foley is the International Programs Coordinator at Global Trade Watch, and really one of the leaders pushing for the TRIPS waiver globally. Melanie, please take it away.
Thanks so much, Arthur, and thanks everyone on the call. So in addition to what Arthur already mentioned about a toolkit that will be coming to you all shortly with some sample tweets and graphics and everything that you can share to help raise awareness about this, we at Public Citizen have been working with allies and other organizations to create some easy to share social media content to inject the broader vaccine equity issue into the US discourse. I'm sure all of you have seen, if you're on social media at all, that right now a lot of people are sharing selfies and posting online when they get their booster shot, and we want to harness some of that energy. So please be on the lookout for some materials coming soon, like a profile photo frame that and a link that you can share when you post along with your photos on the theme of, I got my booster, you should get yours, and take action so that everyone around the world can get vaccinated. And we'll get that to you all as soon as possible. Thanks, Arthur.
Yeah, no, thank you, Melanie. You know, as Melanie is suggesting, getting the word out about this plan is really crucial to raising the profile of the issue, to putting friendly pressure on the administration and others and to getting the job done here. I think we have time for one more question. I'm trying to recap. This is something that's been touched upon already, but I think maybe it's worth repeating. Someone is saying, I've heard that existing companies are already producing all the vaccines that the world can use, and that the bigger problems are distribution and vaccine hesitancy. How do we address that?
Happy to give that a shot if that's.
Yeah, go ahead.
Yeah, so I think while it's true, as I said, that there are issues related to absorption of vaccines, those aren't the only issues, and there are plenty of supply related issues, especially as a consequence of boosters needing to be used. And now it's increasingly a question of the actual kind of vaccine. So it seems as if, and though we need more evidence, that the mRNA vaccines are more effective, especially as a third dose after 2-dose regimen, of protecting against Omicron. Again, that's with a lot of caveats. We still don't know that much. But if that's the case, then we need much greater supply of that, because soon enough, most COVID cases will be Omicron cases around the world. And regardless, even outside of that scenario, there's still, at least in the first part of next year, not going to be nearly enough doses to vaccinate everybody who wants to be vaccinated. So we will need more supply. We'll probably need even more supply than we think ultimately. And there are certainly issues we can't deny, about absorption and implementation, and we should take those seriously. But I don't think it's an either or kind of situation. We both need more vaccines, and we need to do a better job of making sure that people can actually have those vaccines administered.
Just one thing I would add is for folks who would like to have information about those issues, I would just suggest Doctors Without Borders has an amazing website with great studies. If you go also to tradewatch.org, which is Public Citizens Global Trade Watch website, there are a lot of fact sheets. Arthur's going to send a Mythbuster fact sheet that addresses a bunch of this, but we just put up a fact sheet that is specifically about the myth of there being enough supply and the myth of the issue really being hesitancy, because the data is super compelling. There's actually been opinion research done. There's actually much less hesitancy in Africa specifically. There's a test that then there's another survey sample that is African countries plus Latin American and Asian countries. The hesitancy is much higher in the US. It's much lower in the rest of the world. So this is a red herring. This is the countries that the companies that want to maintain their monopolies are trying to point the problem any place else. It's this, it's that, it's whatever, as compared to it being them and their monopolies. And so we just need to not get distracted, and then you can help make sure other people don't buy the lies with these Mythbuster and other fact sheets. And they're written to be accessible. They basically have all the citations, so you can have a fight with someone if you want to send them to the original document and put it spelled out in plain English that this is just baloney. And it's the monopolies of big pharma that are limiting the supplies, and it's fixable. I mean, that is sort of the punchline. I know, Arthur, you're going to close this up with a dispatch, but folks, the thing that everyone needs to understand is this is fixable. We can end the pandemic. We know how to do it. But people power is going to have to beat the greed of pharma. We're going to have to get the medicines available to people. And that is how we're going to do this. And we can do this.
Great. So we are now at the top of the hour. To wrap up, let me thank again Representative Schakowsky, Representative DeLauro, all our friends at Doctors Without Borders, Global Trade Watch, Treatment Action Group, Justice is Global, Other 98, Indivisible, Win Without War, PD America, and everyone here on the Zoom and everyone watching online. For those on the Zoom, please look for an email from me within the next 24 hours that has the action links and other items we discussed. Taking action to urge your representative to get onto the End the Pandemic Now resolution, and promoting that resolution over social media is how we make a difference on this issue. It's how we make change. It's why we're here right now. And for anyone watching online, please email me at info@citizenstrade.org if you'd like more info. I really appreciate all the work that everyone here is doing. It's making a difference, and it's going to make a bigger difference if we're out there pushing the plan now. So have a great night, everyone. Have a great holiday season. Thanks so much. Take care.